Ma'am, how we are going to treat the tubal factor disease?
So, we all know that only in normal tube fertilization takes place. So, if the tube is damaged, definitely the patient cannot conceive naturally, because the egg does not come in to contact with the sperm. So, we need to assess the tubal disease before proceeding into the treatment. Fallopian tube is 10 centimeter long and it is attached to the uterus. So, the disease can affect the portion of the tube which is close to the uterus, or sometimes the disease may affect the tube which is far away from the uterine cavity. So, if it is very close to the uterus and only a small segment like 1 centimeter, less than 1 centimeter tube is affected, in our Guru hospital our protocol is to proceed with hysteroscopic surgery to remove the block. We call it as hysteroscopic tubal cannulation. There is no cut in this surgery. The guide wire is passed through the tube under hysteroscope guidance and the block is removed. But the tube which is far away from the uterus is affected, then we plan for laparoscopic surgery, that we call it as laparoscopic fimbryoplasty. Many a times we come across patients coming to us after family planning surgery, wanting a pregnancy after that, maybe because of late decision, or sometimes after remarriage, sometimes after some mishap in the family. Whatever may be the reason, if the patient had undergone family planning surgery and she wants another baby, it is possible with various treatments. One of the treatment is corrective surgery. Whatever may be the reason, if the patient wants to conceive after family planning surgery, it is possible with various modalities. One is recanalization, that is connecting the tubes, removing the damaged tubes and connecting the normal tubes. Previously, open surgery was the method of choice or only surgery available at that time, but nowadays we go for laparoscopic corrective microsurgery. With a magnification of recent telescopes and also with micro instruments and micro suturing, it is now becoming possible with laparoscopic surgery. We have done a large number of cases of laparoscopic microsurgery for patients with tubal disease or who had undergone family planning surgery. It is really successful, comparable to open surgery with less complications because of less adhesions. So, we have published our series of cases and our experience in reputed journals also. So, selection of case is very important. If it is a severe disease involving total length of the tube, she is not a candidate for tubal surgery. She is a candidate for in vitro fertilization. So, before planning for in vitro fertilization, we need to correct the associated complications she has got. Otherwise, the patient will end up in failure. The common associated problem in advanced disease is hydrosalpinx. That is, the tube is totally damaged, distended with infected fluid. So, even if she goes for IVF, if the embryos come in contact with the infected fluid, the fluid is going to damage the embryos. So, in that occasion, we need to disconnect the tube so that the embryo does not come into contact with the infected fluid, so that the success rates are better in these patients. The other problem is, because of tubal disease, if it is extending into the uterus, damaging the uterus, inner layer of the uterus, if the disease is very extensive, involving the uterus and inner layer of the uterus, endometrium, which is damaged, and ultimately the patient is having thin endometrium and intrauterine adhesions, we generally correct that with hysteroscopic adhesiolysis, confirm that the endometrium is becoming normal, and then only we go for in vitro fertilization for these patients with tubal disease. So, early diagnosis, proper investigation and appropriate treatment of these patients with tubal disease will have a very good success rate and pregnancy rates.